wabarakatuh. Peace and blessings be upon you. And Ramadan Mubarak, dear listeners. Welcome to your Wellbeing Matters Public Health Hour with me, Nazira Vania. I'm a project manager for Community Wellbeing Champions at Public Health at Leicester City Council. And I will be your host for the next 4 weeks as we bring you what we hope will be relevant and engaging programs on the important health and wellbeing matters for our city. Thank you, dear listeners, for joining us today, and a huge thank you to the team at Ramadan FM for inviting us back on the airwaves this year to speak with you about all things public health. I pray that this program will be of benefit to you and yours, inshallah. So over the coming weeks, we'll be talking about a number of things, some of which might sound familiar because they were big issues last year and they are still big issues for our residents this year. So our topics will be fuel poverty and the cost of living crisis, which unfortunately is still going strong after we spoke about it last year. And we'll talk about the help that's available for those that are affected by it. We'll be talking about the recent increase in measles across the country and locally, and the importance of the MMR jab and other vaccines for children and adults. And we'll also be talking about the vision and priorities for public health in Leicester, about how to tackle the health inequalities across the city, and having a career in public health and also public health research. But before we get to all of that, we'll be kicking off with a tour of services and support available to help people with their mental and physical health and well-being. So I'd encourage you to grab a pen and paper or have the Notes app ready on your phone, because we'll be sharing lots of information about services that might be helpful to you or to someone, you might want to take notes down for someone like a family member, a friend, someone you're caring for, or just anyone else in your network. Of course, the audience is always the most important part of a show, so we also want to hear from you. You can send comments and questions via social media if you're watching online, and the chat, or you can send a message to the studio on 0774 885 5055. I'll say that again because I sometimes speak too quickly. 0774 885 5055. Okay, so hopefully you've got that down, and we'll get started with the show by meeting our guests for today. We've got Amy Jones and Mark Quinnell here today with us in the studio. Welcome, Amy and Mark.
Hi.
Hello. How are you today? Apart from nervous.
Good. Apart from being nervous.
Yeah. Good, Mark. Brilliant. Good to hear it. That's how people in public health should be. So, Amy, you're a program officer in our mental health team in public health. So please tell us a bit about yourself and your role.
Okay, yeah. So my name is Amy Jones. I am the Suicide Prevention Program Officer as part of the mental health team in public health at Leicester City Council. I've been in this role now for approximately 9 months, but my background has always been working with the general public around mental health, substance misuse issues, and previously worked within the prison service as well. So I've always been in and around mental health. So it was really nice and move for me to move into this and be part of the bigger picture and help to respond to mental health on a community level. So part of my role is to advance conversations around mental health within our communities and to bring it to everybody's radar. Making mental health everybody's business. We talk about our physical health all the time, but we need to talk about mental health too, as it's equally as important. So a big part of my role is looking at data, listening to feedback from people, a lot of joint partnership working, and looking at identifying need and if there's any gaps within communities and trying to respond to this as best we can. I'm also involved in a group called the SAPG, which is where we monitor real-time suicide suspected suicide data, which also helps us to look at what is going on in our communities and what we need to respond to. But I can talk about that a little bit more in a bit.
Okay, thank you, Amy. And Mark, you are, I'm going to get this right, because you've just had a job change. So you're a Live Well coordinator for the Healthy Lifestyle Service in public health. So that's working more on the physical health side of things. So please tell us a bit about yourself and your role.
So I've worked with the council for about 18 months now.
Okay.
I started off as a healthy lifestyle advisor that helps the centre promoting healthy lifestyles, getting people exercising, making sure they're eating properly, doing everything they need to promote a good health, really. And then recently I've just been given us a common role within Live Well Again as a coordinator, working with the hub team, so managing referrals that come through from GPs, physios, for anybody that wants to access the healthy lifestyle service.
Brilliant, thank you. So both very, very busy people then. Okay, so the topic of mental and physical health and well-being is a really broad one. That's like a massive umbrella and lots comes under that. So we will break it down by taking it in turn a little. And we'll start with mental health. We'll go in that order. So back to you, Amy. Now, mental health, I'm going to start with a simple question, but what exactly do we mean when we're talking about mental health? Because that term can mean a lot of things to a lot of people.
Yes, it certainly can. So, mental health is a person's state of well-being that enables them to cope with the everyday stresses of life, how they're able to achieve within their life or in their personal circumstances, and their ability to build resilience when things don't go so well. So it's their general well-being of their mind. It's that in essence.
Okay, thank you. And so who can be affected by poor mental health?
Everybody can be affected by poor mental health. A saying that I've always said within my previous role is that none of us are robots. If we were robots, we would be able to deal with everything the same way the whole way through our lives. We're not, we're human beings, and we may have been able to deal with certain things in the past really well, but it comes to another time in our life and we can't. And then, that can impact on your mental health. It can cause depression, anxiety, and it leaves you thinking, why can't I do this? Why I've done this before, why can't I do it again? And that is purely because life throws curveballs at us all the time, and our ability to cope changes throughout our life. So it's really important we look after our mental well-being and recognise that not every day is going to be a good day. Some days we will have bad days, but days do get better. So there's lots of things that can impact on a person's mental health. So many things, but in particular, one thing I do need to raise, because it's still on everyone's radar, is COVID. During that time, I think a lot of people experienced mental health. We were away from our loved ones, away from our support networks. We had to deal with mass change. One day we're out, next day we're in, and we didn't know when we were next coming out. So, a lot of people experienced that isolation, being away from people, not being able to engage with their family or their support networks as well as they could before. That constant anxiety of what's going on out there, how do we deal with it? So I think that COVID really exacerbated mental health for communities, and it kind of brought it onto everybody's radar without knowing. That COVID has had a significant impact on people's mental health. We are now, as you mentioned before, we've got food poverty and cost of living crisis coming up in talks in a few weeks, and the cost of living at the moment is having a significant impact on people's mental health. That, am I going to be able to feed the family? How do I cope? How do I manage the bills? I've got debt, that's creeping up. That has such an impact on somebody's mental health, because you're constantly thinking, how do I provide? That can really take its toll on somebody. But not just, those are two big things that we've just spoken about there, but everyday adversities that people go through also impact people's mental health. So, if you don't get enough sleep, that can leave you feeling drained, can leave you feeling down, that can impact on your mental health. If you experience stress within your life, that, continued stress will have an impact, may lead to anxiety, may lead to low mood. Just being for me, myself, just being a busy mum, having a job, trying to, navigate having children and all that, remembering everything that school, sends through daily, things like that, owning your own business, having a huge workload, relationship breakdowns is a huge thing, your ability to bounce back after that, or, it leaves you feeling, not good. So there's so many things that impact on people's mental health. But one thing I do want to talk about in particular is the stigma around mental health.
Yes, absolutely, because it's one thing to have the impact, but then finding it really hard to get help for that, to name it, and to recognise that you have those needs. So, so please tell us a bit more about that.
So, a big part of my job is to try and break down the stigma around mental health. We know within certain communities that, mental health is a taboo subject. You don't talk about it, bury that down, carry on, keep going. But if you don't talk about your mental health. If you don't reach out for support, it's like a boiling pot, you know, it just continues to boil to the point where somebody just can't take it anymore. And that is what we call reaching the point of crisis. And a big part of our job is to stop people getting to that point of crisis. We want people to reach out for help before that, look after their mental health, talk to other people, access the support that's out there, because there is so much support out there that people can access, and it's about making sure that people know about that. And it's okay to have poor mental health. It's okay. It's what you do about that matters. As I said before, we're not robots. At some point in everybody's life, we're all going to experience it in some way, shape, or form. But it's about recognising that and knowing what to do with it. Ultimately, my job is to get people out there seeking that support and looking after themselves mentally. And Mark's job is to get them to look after themselves physically.
Well, we know there isn't a clear-cut line between that, because the mental health affects physical health so much, and the other way as well. So the things that you can do to look after yourself physically helps your mental health and so on. So we'll go on to that now, about the what help there is. So you've got some mental health needs, you want some support. Where do you get that? What help is available?
Okay, so across Leicestershire and Rutland, jointly with Leicestershire County Council, we have our own website called Start a Conversation. So the link for that is www.startaconversation.co.uk, and that is our mental health and suicide prevention website. I would implore all of you to take a look at that and get that onto your radar, because this is something where there is a wealth of information around mental health, what to do if you're experiencing poor mental health, what to do if somebody you love or somebody you know is struggling, and knowing where to signpost them onto for the right support. There's lots of information on there about if somebody is experiencing self-harm or having suicidal thoughts, how to safely have a conversation with somebody in that moment, knowing what to ask, what the important questions to ask in that moment, and where to point them in the right direction of going to, and just encouraging people to talk and feel confident to have them conversations. There is 20-minute suicide prevention e-learning on there. I know the word suicide is really scary for people. Suicide prevention is more about what I said before, in stopping people reaching that point of crisis. This crisis could inevitably, and I can't say the word, inevitably lead to suicide, and that is what we are trying to stop, particularly in my role. There's lots of information on there about services that you can access in your community, in different areas, so in the city and in the county, but obviously today we're here to talk about the city. So just an example of the services that are out there. If you do find yourself at that point of crisis and you are struggling and you really need to reach that support, I would urge you to ring the Central Access Point. The number for that is 0808 800 3302. This is a 24/7 helpline where you can call, explain to somebody how you're feeling, and they can do an intervention with you over the phone. And if they need to make onward referrals for further help, they can do that. So I would urge anybody that had that feeling that they can't keep themselves safe to access the Central Access Point.
Can you repeat that number for us then, please?
Of course, 0808 800 3302. And we also, in local communities now have neighbourhood mental health cafes, which are drop-in sessions for people that need support with their mental health. I believe that we have one in Highfield, we have one in Belgrade, we have them situated all over the city. If you go onto Leicestershire Partnership Trust website, they have all the details of the neighbourhood mental health cafes. But these drop-in cafes are for people to go and access support. There will be trained mental health facilitators there that can do one-to-one conversations with you. They can look at coping mechanisms and what to put in place to help you moving forward. They may have group sessions set up where you can talk to other people that are experiencing the same sort of thing. There's lots of different things going on at the cafes, but you will find something that's tailored to you that's there. You don't have to go once, you can go numerous times if you want to, if you need that support. But again, if you need further mental health, then they can put those on referrals in for you there and then. So it's just letting people know that there is somewhere that you can go within your local community to have
So
that
it could just stay with the neighbourhood mental health cafe for a minute, because when I first heard about them, I was picturing a cafe. But they're not. They're in community settings, aren't they? So, for example, the Highfields one, which is run by the brilliant Rehana Sidat of Jameena's Legacy, who has a show, I believe, on Thursdays on Ramadan Radio. So you'll hear from her in a couple of days' time. But so that hers are, Merlin Bass and at the African Caribbean Centre. So they're in community settings. Their sessions at a particular time of the week, the day, and you drop in. That's when they're running. So the cafes within those community settings. And they've kind of been chosen that way as well. So they're comfortable settings for you to go to locally.
Absolutely.
The community reflects you. You can feel comfortable. You're with people like yourself. And you'll see you're not alone.
Yeah, absolutely. And I think the term cafe comes in because there is refreshments there.
Yes.
If you need them.
Yes, I know, because I visited Rehana's cafe and they had some very nice things that I was working very hard to resist having. Okay, so that's a neighbourhood mental health cafe.
Yes.
Yeah. Okay.
And also, again, for urgent support, I would recommend ringing the Samaritans as well. Again, they are open all hours. They are there to have safe conversations with people, and just give somebody that sort of helping hand in a time of need. And just showing people that, what is happening to them in that moment is not going to last forever. That, it will get better. So that's the urgent help. We're talking sort of top end of the scale. You're really, really struggling.
Yes. Yeah.
We don't want anyone to get to that point.
Yeah.
Hence my job.
Yes.
But if you are finding that you're just struggling with your mental well-being in general, you've been feeling low for a while, or you're suffering with anxiety, stress, struggling with sleep, then there is other places that you can go to for support. Firstly, I'd always suggest talking to your GP. It's good to make sure you're keeping that conversation open with your GP. There may be things that they can do for you in an appointment. But there is also talking therapies that are available, which your GP would probably recommend anyway. But you can self-refer through to this, and it is called Vitaminds. So if you put in, I think it's Vita Health in Google, the website will come up. If you click Leicestershire and Rutland, you can self-refer through their website. I'm not sure if there is I don't think there's a mega long waiting list at the moment, but if there is a waiting list, they do give you information, the option to join onto groups, things like that in the interim before you get that one-to-one support. So there is lots that you can get from that, aside from the one-to-one talking therapy.
Break down that term for us a little bit, talking therapy. What does that mean?
Okay, so it's cognitive behavioural therapy. So it is having somebody to talk to about your problems. They're not going to give you the answer to the problems. What they're going to do is to get you thinking about what is going on and to navigate it yourself and to come up with a solution to make it work better for you in the future.
Okay.
So it's about retraining your mind in essence to do things differently in the future or to act a different way in the future. So yeah, it's really helpful. Cognitive behavioural therapy can be really useful for people, and it's having somebody outside of your support network that you can talk to and open up to, and that can really help.
Okay.
We also have P3 service in Leicester, which is a mental health service where people can access. They do group support. They also do one-to-one support about mental health and well-being. Again, I would just say have a look at their website, have a look what they offer. But again, there is support out there. You do not need to struggle on your own. There are so many things that you can learn by engaging with these services that can prevent your mental health from escalating in the future.
Okay. Brilliant, thank you. And so you've talked about support that's available, and at that sort of early level support, so lots of kind of building resources in communities so people are getting their help at the right time and not reaching crisis. Yeah. So there's another scheme around that as well, is it? Mental health friendly places. Yes.
Not just mine. It's a joint scheme with Leicestershire.
So tell us about mental health friendly places.
Mental health friendly places is a project that we launched in October last year in the city, and in essence what mental health friendly places is asking community organisations, grassroots, barbers, hairdressers, cafes, anywhere where there is a footfall of people that are having conversations. And we're asking people to come forward to be a mental health friendly place, and then what we will do is give you free training in mental health to increase your confidence to have those conversations with people, to know where to signpost somebody for the right support at the right time. And it's just about building on that community capacity and getting people talking about mental health in their everyday lives. You know, we don't want it to be a taboo subject anymore. People will talk about their physical health. We need you to start talking about your mental health. And if we can get people in our local communities upskilling themselves and saying, we're happy to have conversations like that, the better. We're going to reach so many more people that way. And again, get people engaging in the services that they need to keep their mental well-being good.
Yeah, and so imagine you're that cafe or shop and you've got that sign in the window and someone feels confident to come into your place and bring up that, I'm struggling, I need some help.
Yeah, definitely. And the training that we offer, so we ask for 80% of an organisation to do the 20-minute suicide prevention e-learning on our Start a Conversation website, and then for 30% of the organisation to go on to do either accredited mental health first aid aware training, which is through Mental Health First Aid England, or Samaritan's listening skills training. So, learning how to listen properly to somebody when they're talking, or what to draw out of those conversations to respond back to that person. So, those are the two levels to it. If somebody's gone through that process and they're thinking, I really want to learn more about this, then we do have a third level, which is optional, and that is to go on to do the full 2-day mental health first aid course. So that's that extra, gives you that extra level to it. We've tried to keep it as time limiting as possible, because we understand if people are coming forward to mental health friendly place, that they already have a business, they already have their days are busy anyway. So the mental health first aid and the Samaritan's listening skills training is 3 to 3.5 hours long. So we've tried to keep it as short as possible, but get as much information out to you in that time. So please sign up to be a mental health friendly place. I did notice today, as I drove through the area, what a bustling community we have in this area. There are so many places that come forward to be a mental health friendly place and support people within their community. So if you would like to, please go on to www.startaconversation.co.uk. There is a tab on there that says in your community. If you click on that, it will take you through to the mental health friendly places. There's lots of information in there about it, and you can register through that link as well.
Brilliant. And just because you said 80% staff, that sounds like big employers. Okay, but it's still suitable for small businesses with just a handful of employees.
Absolutely, okay. 100%. So, I mean, the smaller businesses tend to know their customer base, really well. When people, particularly cafes, things like that, barbers, you've got somebody sat in a seat for a good half an hour in front of you. They are unpaid therapists without knowing it, really. And if they can get that training and have those conversations with people, then all the better. So
Okay, thank you. So we'll just wrap up a little bit because Mark might be feeling a bit left out. So we'll just to wrap up the sort of mental health side of things. What are some basic tips that we could all do with following to look after our mental health?
Okay, so there is something that you can do to look after your mental health, and that is the 5 ways to wellbeing. So there's 5 elements to this. I'll go through each one, and then it might tie in nicely to what Mark did. So the first one is to connect. So that is, connect with your family and friends, connect with your support network, go and join a group, reach out to people. So connect with others, and it can really do good things for your mental well-being. The second part of that is to be active. So this will tie in quite well. So move more. Go out there and exercise. It releases them endorphins. That feel-good hormone. So also going out into green space, into open areas, so you can see, connecting with nature is a really good thing as well. So going out walking, things like that, really good. So do that. It will really help with your mental well-being. The third is to take notice. So when we say take notice, this is about just connecting with what's going on around you in that moment. So people may know it as mindfulness. So it's about just taking that time out, sit down, have a bit of quiet time, or you could do it while you're walking along. But notice what you smell, what you see, what you hear, but just really connect into that, because it can really ground you and just bring you back to that moment and take all those stresses out of your mind that's floating around. So just engage in a moment and just appreciate what's going on around you. It can really help just ground yourself and bring you back. And then the next one, number 4, is to learn. So learning new skills is so good for somebody's mental well-being. So try. You may have wanted to always do something and never got around to do it. So try that new thing. Try cooking. Step out of your comfort zone. Learn something new. You're building on yourself then. You're investing in yourself by doing that, and it gives you that sense of achievement.
Yeah.
So learning is really good for your mental well-being.
Yeah.
And the last one is to give. So giving back to people, or within your community, is a really good thing to do. It really makes you feel good about yourself. So maybe engage yourself in some volunteering or help others. It may be carrying somebody shopping across the road, something like that. Just something really simple can really help. So random acts of kindness, anything like that will really help you to feel better about your mental well-being. And there is also another way you can give, and that would be to come forward and be a mental health friendly place.
Good, very well done plug there. All right, thank you, Amy. So we'll go on to Mark in just a moment, but I will just take a moment to remind listeners that you can get in touch with your questions and comments on social media, or by messaging the studio on 0774 88 55055. That's 0774 88 55055. So I will now come over to Mark. Hello, Mark. We're going to learn from you now about the services that are available through LiveWell to support people's physical health and well-being. So LiveWell is Leicester City Council's healthy lifestyle service. So we're going to go back to basics, like we did with Amy and mental health, and look at that term, healthy lifestyle. What does that look like? What does it mean?
So a healthy lifestyle basically is making sure we're moving. Moving is key. It doesn't have to be going to the gym. It doesn't have to be swimming. As long as we're out walking, a half an hour walk a day is known to do wonders for your health.
Yeah.
Making sure we're sleeping properly. 6 to 8 hours is the recommended amount for sleep.
Yeah.
A lot of people that I tend to see hardly get that. So making sure we're doing enough to make sure we're sleeping, making sure we're comfortable, we're doing all the things we need to. I always say to people, a cluttered room is a cluttered mind. So think about your bedroom, how it's set out. Are we drinking enough? Obviously, that's water. We should be drinking at least 1.5 to 2 litres of water a day.
Yeah.
That can include your tea, coffee, everything else, but we need to make sure that we're hydrated.
So in Ramadan, that's a bit of a challenge.
It is at the moment, obviously.
But certainly, like making sure you're observant of that, sort of when on the non-fasting hours, to make sure you're rehydrating, and sleep as well can be broken in Ramadan. But whatever you can fit in a nap here or whatever to make up for that time. Yeah.
But it all leads into one. So
as
long as we're doing the basics that we need to do, we will have a healthy lifestyle. Exercise is the key one, making sure we're moving and moving enough.
Yes. Okay. So on that, on that note, then, how can LiveWell help people to achieve those healthier lifestyles? So, what are the services? Where do you want to begin? Shall we begin with Steady Steps?
We can begin with Steady Steps if you want to. So Steady Steps is our full prevention service. It's a 24-week program that's tailored around the individual and their needs. It's aimed towards people over the age of 65 that have either fallen before or have a fear of falling. So obviously it's for the older generation, but obviously to keep them mobile, making sure that during that 24-week program the exercises are tailored to their needs. The exercises they do are specific to those individuals. It's not a case of a generic class for everybody. There's at least 3 exercises that you can try. One that starts off dead easy and then builds from there. So it is very tailored to you as a person. The whole idea is to improve your daily life. That's the whole idea of it, improving the confidence and the independence to go about your daily life, improving your balance, your stability, your flexibility, your strength, so you can carry on doing the things that you enjoy doing. So that's Steady Steps.
That's brilliant. And because you said half an hour for many people, half an hour could feel really ambitious, really difficult. For old people, less mobile people, so services like this are really important to support people into that.
So we got Steady Steps, but then also for walking we do have LiveWell Walk More. So that's their local walks in the local areas of the city. These are literally just free. You can call the number, which I'll give you later on. But this is a free walk that just around the city area itself. They range from half an hour to an hour and a half. They're led walks as well. They're led by volunteers or led by 2 very lovely chaps called Ravinda and Chiro, who do wonders for the local communities, getting them out walking. They're every day of the week as well, from Monday right through till Friday. So they're a good thing to do. It's also very social to get you out, get you meet new people. Social obviously comes under the mental health side of it as well, meeting people, chatting, making sure you're meeting people, new people as well sometimes.
And do you have to be a certain level of fitness to join a group walk? Because I think about group walk and I think, if I'm going to hold everyone back, I'm not very fast, I'm going to hold everyone back. So, could be off-putting. So
yeah, definitely. No, there's no general fitness level for the walks. So there'll be a walk leader at the front, a walk leader behind. They'll be in high-vis jackets. You just station yourself wherever you feel that you need to. So they don't tend to walk very briskly. It's a nice, gentle stroll around the area they're in. So level fitness-wise, anybody can try it.
Yes.
Anybody can try it.
That's very reassuring. I might just do it. So you mentioned that group walks take place across the city. So can you give us some examples?
So Mondays is Beaumont Leys and Hamilton. So they go from Beaumont Leys Library and Hamilton. Beaumont Leys Library and Hamilton, just by the Tesco's, the library there. Yeah. On a Thursday it's in Elston. They go from Elston Leisure Centre. On a Friday it's from Town Hall Square. Okay. They walk around the city centre, which is nice. If you look up some of the buildings in Leicester, absolutely stunning. It's when you tend to look down, people realise it's.
Yes.
And then the other ones are just dotted around. There's one from the Belgrave Neighbourhood Centre. There's a few around the city. So. Okay.
And I should just mention there actually, because there is the Let's Get Together programme that Leicester City Council run public health. And that also has lots of activities which support inclusion, so things in libraries and community centres, chatty tables, and something called sociable strolls, which again is sort of guided walks. And there's a lot of history and a lot of interesting things to see in Leicester, so they sort of explain that as they go along. So that if you go on Leicester City Council's website, leicester.gov.uk, you'll get those details of all of that as well. And I have to say that because my manager runs Let's Get Together, and I'll be in trouble if I don't plug that out. So lots of guided walks, and there's lots of information as well on active travel. So what is active travel? That's about.
It's just about getting out and moving, getting out and walking to work if you can, obviously, but getting out and just moving around the city in different ways. Obviously, cycling. Yeah. Obviously, all the new cycle routes around the city are coming into place, which is a great idea. So using those to get around. Obviously, there's a free cycle park as well by Town Hall Square where you can take your bike in and park it, and it is secure.
So lots being set up to encourage walking and cycling instead of cars, basically. Okay. All right. So that's the kind of physical activity. But one of the biggest contributors to poor physical health is smoking. So particularly cigarette smoking. So helping people to stop smoking is actually one of public health's biggest priorities, because there's no safe level for it. So that means there's no level of smoking at which it does not cause harm to health. So Mark, can you tell us a little bit about that to begin with, the impact of smoking on people's health?
So obviously we all know the major health conditions that come into smoking. So obviously you've got things like COPD, asthma, any pulmonary disorder. COPD, oh, no, you tell me that. Coronary.
Okay.
Yeah,
sorry.
That was a bit hard, wasn't it?
Oh, I'm so sorry.
I know the last bit is pulmonary disease.
See, I can't answer that either. So I'm putting myself on the spot there and exposing COPD. Okay. Yeah. So sorry. COPD.
So these are all conditions to do with the lungs. Yeah. So obviously, as we smoke, our lungs fill with tar from the nicotine in the cigarettes. So then basically what happens is this closes up what's called our alveoli in our lungs. These are the filtration system that takes the oxygen out of the air that you breathe in and filters it through into your blood. So the smaller and the less alveoli you've got, the less oxygen you will have in your blood. So obviously the impact that has on your life is quite a major impact. Obviously then you've got things like stroke, heart disease, these all go up through smoking as well. Okay. Obviously this isn't just the people that smoke. This is also through passive smoking. So if you've got young children and you're a smoker, it is harmful to them as well. So that's something to be mindful of.
Yeah, that is a massive thing as well. With who else is affected by the smoking? It's not just the smoker. And you said the words alveoli, and you gave us a very technical explanation there. So I'm going to let you off the hook for this. So the impact of smoking is massive, and it's not just on the smoker, but on those around the smoker as well. So there's lots of good reasons to quit.
Oh, 100%. And we can help with that.
Yes. So how can we help?
So we offer a free 12-week quit smoking program. This program is run alongside a stop smoking advisor who's either there face-to-face or over the phone to give you advice and stuff like that. You'll meet with them once a week. And obviously from there, they can advise you on what to do to stop. Obviously, we do hand out products, so like gum and patches and bits and pieces like that to aid you, but it's more as well that it's finding out the triggers. Sometimes with smoking, there is a trigger.
Yeah.
You tend to stop smoking, you tend to maybe start reaching for biscuits and chocolates. That's where our healthy lifestyle service can come in and help out as well. But yeah, it's just finding out the behaviours around why do you smoke. And 9 times out of 10, if you can change that behaviour, you can quit.
Yeah, so it shows again the connection between physical and mental health as well, because if stresses are causing you to smoke, and then if you stop smoking, you're coping with those stresses, what other support is available there. So again, lots of connection there to be mindful of. So the program, so you talked about nicotine. I had a question yesterday. I said vapes and e-cigs as though they're the same thing. They're different.
They are slightly different.
Are they used
so we do use electronic cigarettes, but obviously the studies into those are quite short term at the moment, so there's no long term studies into the effect that has on your health. So at this moment in time, we do use e-cigarettes.
Yes, but my understanding is that that's as part of a planned
quit program,
not encouraging people to take it up.
So obviously that's a product that we would say to you use if we felt it was necessary to use.
But as a safer alternative,
relatively to cigarettes.
Stepping down, not sort of to take up for the fun of it.
No, definitely not.
Just to be clear, listeners, don't start don't start on e-cigs or vaping. Okay, so that's smoking. So a 12-week program, completely free to the client.
Yeah, all of our programs are completely free. Obviously, they're through a referral service. Obviously, I did mention the healthy lifestyle service.
Yes.
And that is our physical activity side of things. So again, that's a 12-week program that you're referred through by a GP or some form of health practitioner, so physiotherapist. And basically how that works is you come into the gym, you meet a healthy lifestyle advisor. It used to be me at Elston, but I'm not there anymore. Yeah. But you come in, you meet them, they go over your referral. So you're referred for a specific medical condition. It could be arthritis, it could be type 2 diabetes. Obviously that's quite prevalent at the moment in Leicester. So it could be any health condition that you've been referred with, and you work with that healthy lifestyle advisor to change your health. Again, changing those behaviours around how certain foods, certain things that you do during the day that we mentioned earlier. Are you staying hydrated? Are you sleeping enough? Are you eating properly? Has an impact on your life, and obviously we're there to help you every step of the way.
Yeah. Okay. Brilliant. So another service, I'm just kind of making sure I cover all the key services that LiveWell provides, and one of them is support with reducing alcohol consumption. Might not seem relevant. The Muslim faith is a teetotal one, but there might be some people in the community who want support with this, or who know someone that does need support. So please tell us a little bit about how LiveWell can help people with reducing their drinking if they're concerned about that.
Yeah, so we work alongside Turning Point, which is a charity that advises people on how to lower their alcohol intake or stop completely. Yeah. So again, that's a referral system. You're referred through self-referral by your GP, and from there we guide you over to Turning Point. You sit down with it. It's almost a bit like the stop smoking service. Yeah. So you sat down with those people. You're going over again any triggers, why do you drink, how often, that sort of thing, and then they're there to support you every step of the way to obviously lower your alcohol intake. Yeah. Or stop completely.
Okay. So, and one of the kind of things we need to be mindful of is with diverse community in Leicester. There's lots of different cultures, religions, and needs. So all of these services that we've mentioned are sort of sensitive to that, aren't they? They're aware of that, and they do cater to different needs such as language and things like that. So can you, I'm just going to look at one of you to go in there and sort of talk a little bit about that.
Okay, yeah.
So we do cater to obviously needs. Obviously through the hub advisors who I work with at the moment, we organise interpreters. Okay. So when you get a call with the hub, they'll organise an interpreter if your GP has said that you need it, and then from there, obviously we can relay all the information over that we need to, knowing that it's completely understood. Sometimes that's the biggest thing when there is a language barrier. People tend to be a little bit afraid to come forward and think, oh, who can I talk to? But we are here to help. We do have services that we can implement, like the interpretation service.
Yeah, so. Brilliant. And I know, for example, Turning Point, who you mentioned with the alcohol support, they work with Spinning Hill, Drug and Alcohol Service. So a lot of these organisations then work with a partner up and deliver with community partners as well. And it's the same with mental health support, Amy.
There's, like I mentioned earlier, there's so many services available. There is specific services as well for certain communities. So there is the ad hoc project within Leicester, which is purely for the BAME community.
BAME meaning Black, Asian, minority ethnic. Okay. We knew that one. Okay.
But we also Jamila's Legacy, which a lot of people know of. She's really good at tailoring into specific communities. A big part of what we'd like to do in the Leicester Health team and public health is to look at training people on mental health within sort of South Asian communities or Muslim communities, to get people to better understand that as well, because we need to respond to everybody. Like you say, Leicester is so diverse. We need to make sure that we are catering to everybody and what we do, and that's really very much on our radar.
Yeah, and that sort of peer support is really important, isn't it? Sort of being able to go to people like yourself, so you feel understood and comfortable.
One of the things about the Healthy Lifestyle Service is you find out that you're not alone.
Yes.
There are people out there that suffer as much as you do, particularly these osteoarthritis, pain conditions, fibromyalgia. These are conditions where people tend to think, I am alone.
Yeah.
But with the Healthy Lifestyle Service, obviously with your service as well, it's very much that you're not. There are people here that are in the same position.
Absolutely. And when we were talking about the neighbourhood mental health cafes earlier, a lot of the people that go to those mental health cafes or that volunteer at those mental health cafes have lived experience of mental health. So what better place to go than somebody that really understands it?
Absolutely. Agree. And so we're kind of reaching the end here, but just to summarise back to you, Mark, again, how do people access Live Well services?
So obviously, like I said, we are a referral system, so you can be referred by your GP. So if you go to your GP and ask to be referred to the Live Well service, they will refer you on. You can call us on 0116 454 4000. That's 0116 454 4000. You'll come through to my team, which is the hub team. They're amazing. Plug them now. You can also visit our website at livewell.leicester.gov.uk, and you can self-refer through there as well. And also we are on Twitter or X, depending on which century you're born in, at Live Well Leicester. That's with Leicester with the L-E-I-C-S on the end, and we're also on Facebook with Live Well Leicester. So there's a lot of ways you can contact us.
That's great, because I forgot to make a note of our social media handles, so you've just taken they are the same social media handles for anything public health at the Live Well, and also please visit that to get information, and also the leicester.gov.uk for information on public health. So we are sort of coming towards the end. I'm just going to make sure I've mentioned everything we're meant to mention. Okay, so thank you, Mark and Amy, for your grand tour of services and support for physical and mental health. There is a lot there. We did cover a lot of ground. So if anyone listening, if you missed something, don't hesitate to get in touch with us. I'm going to give you one more email address, but this is the one that kind of like is the single point of contact, so it's worth noting down for this show and future ones. So Wellbeing Champions at leicester.gov.uk. So that's Wellbeing Champions as one word at leicester.gov.uk. That will bring you through to my team, the Community Wellbeing Champions team, and we connect with community organisations, professionals and others, volunteers, people working in communities to promote health and wellbeing. There's a network, and if you're interested in joining to find out more about how we can connect, collaborate to improve the health and wellbeing of the people of Leicester and help reduce health inequalities, because we are so much worse off in Leicester across a range of conditions than elsewhere in the country, and there's inequalities within the city as well. So there's lots of work to do to achieve better health and wellbeing for all communities. So we are wrapping up now. I'll be back at the same time next week with my guests Ed Quick and Shelley McDonald, who will be telling us about the work that's been going on in the city to support people with the cost of living and fuel poverty. I look forward to connecting with you then again, inshallah. If you have got any questions, if there is anything you want us to cover in the remaining public health shows, again, please just get in touch on wellbeingchampions@leicester.gov.uk. So all that's left is for me to thank my guests, Amy and Mark. Thank you very much. Thank you for coming. And to thank Ramadan FM, and of course to thank you, the listeners. Wish you a blessed day.